Tonight we're hoping to give you some info of how do you talk to others about chiropractic. And my book, Chiropractic, is something that should be as simple as brushing your teeth. Your spine needs to move. It needs to be clear of subluxations or cavities. And you should be getting regular checkups. You may or may not need them, but you should be getting them. And most people don't even realize that chiropractic is probably your first avenue to try to attack certain problems. But it becomes the last. So we're going to talk about how do you talk about chiropractic. Our hope is that we can talk about chiropractic. What's it actually doing in the most simple terms that we can describe? Does it really work? I mean, there's some people, I can't tell you how many people will say, well, my husband, he won't be coming in. He doesn't believe in this. Or my friends, they don't believe in chiropractic. And I have people that, that do this for a long time, and sometimes they get frustrated and they go, so you don't believe in gravity? It just works. It's a science, it's truth. But besides that, we're going to talk a little bit about, what do we see in chiropractic, what's this placebo effect and how does chiropractic work scientifically. We're going to talk a little bit more about that pop. People say, I want to get cracked. We don't like that term. You're getting adjusted. If eggs are cracked, people are adjusted. If you're subluxated, your spine has a dysfunction that needs an adjustment or realignment. We'll talk about the adjustments, how safe they are. I think one of the biggest misnomers out there, I can't tell you how many medical doctors, if they're a little concerned about someone's care, they somehow think chiropractors can't adapt to changes and think, oh, don't do that. Don't do that chiropractic, you have this or that. So it's just the more you can understand about safety and our ability to, make unique treatment plans will help you understand that anyone could receive chiropractic, even if you're fused together in a lot of spots of your spine. If you've got vascular problems or other diseases, we can still work with you. It just might be different ways. That's why me and Dr. Braden have worked so hard at learning lots of different techniques to do that. We'll talk a little bit about headaches because it is the number one thing that a lot of people come in with. And, do you have to keep coming forever? Well, that's going to ultimately be your choice, obviously. Well, let's talk about chiropractic. Chiropractic is built on the premise that your body is a self-healing and self-regulating organism. And in order for that healing to be able to spread through your body as efficiently as possible, you need a system that's going to share that information. That's your nervous system. Your spine and the bones of your spine are very closely related to your spinal cord and those spinal nerves. And if your spine is out of alignment to some degree, that nervous system has altered function. So we want to just relieve tension on the nerves. If the nerves have less interference, the better you work. That's the most simplest way that we can describe it. The easiest way is to imagine a garden hose. And if the water's flowing through that garden hose and I put some pressure with my foot on that garden hose, I'm going to alter the flow of that water. It's the same thing a subluxation does to the nervous system flow from your brain to your body. It alters the flow. It's not that it's totally cut off. I didn't put all my weight on that hose and the water's just backing up. It's still flowing through, but maybe not at the same velocity or intensity or amount, volume. And that's what we need with your nervous system. Helping your nerves and your muscle system work the way that they're supposed to. That's what hands-on technique in chiropractic can reset your body just like we reboot a computer. The simplest way. Does chiropractic care really work? The chiropractic care has been around now for 135 years, I think, last year, so 136 years. The birthday is in September 18th, just so you know. The first adjustment, this is part of our trivia if you guys ever come to it. First adjustment was 1895, September 18th to Harvey Lillard. He was a janitor at the school. Just remember that. He was deaf, and he actually was able to hear after his adjustment. So they're like, well, this is weird. So this is where it came from. But that could have been hearsay and who knows what. But what does the science show over this 100 plus years? Well, it absolutely does change bodies. In a large trial, they did 400 patients with chronic low back pain. They received 12 sessions of adjustments over 6 weeks. So it's kind of a beginning care plan in our office. They saw meaningfully better, less pain and disability outcomes than those who received nothing. So chiropractic care has been proven in the research. This is just one of the many, many studies. We don't need more research to show chiropractic works. What we need is better education. This is why we're doing this workshop, so that you can talk to other people about the safety and the effectiveness of chiropractic. One of the best things that work comp does, if you had a company, is to have a chiropractor on staff. It reduces care by possibly 60% than seeing a medical doctor. If you were injured on the job and you saw a medical doctor, you would actually have about a 40% chance of getting surgery, but only about a 4% chance of having it if you saw a chiropractor first. That's why there was a study up, I think it was Wisconsin actually. So, we don't just adjust you, once though, because your body has had so many events that unfortunately all of us have knowingly and unknowingly created the conditions we're in. But what we can do is try to help your body one step at a time start to change the functions that have happened, dysfunctions over time. And if it's been a decade or 2 or 3, most of us have had falls and slips by the time we were 10. You have about 4,000 impacts to your body by the time you're 4. Doesn't mean they all cause a subluxation, but even if only 4 of them did, that's still 4. right? And that's a really small percentage. So our bodies need checked regularly. And it's not that even if once we did adjust you and your body was functioning at a better level, that you're never around stress or traumas or toxins again. We live in a very unnatural environment that puts stress on us. And the best way to do it, to reboot that, is to take that out of our physical body. That's the adjustments. The chiropractic adjustments absolutely work. The research would show that. And different conditions benefit in different ways. Not everyone will have a pop when you get adjusted, but many people will have a release or a cavitation, we call that. Very simply, to make sure we put everyone at ease, this is not bones cracking. Number one, if bones were cracking, our overall practice would be much higher. It's very hard to crack someone's bone, to be honest. Can it happen? Absolutely. That's why we have what we call an informed consent in our office. Yes, things can happen, but the pop has nothing to do with the bones. It's actually the joints. So the joints come together, and any joint of your body comes together, two bones come together and they form a joint, and there's fluid in that joint. There's fluid to help those surfaces move around. That fluid becomes under pressure. If you have a subluxation, which means a restriction of motion, that fluid becomes under pressure, and when we stretch that fluid quickly, it actually puts pressure on that fluid, and that liquid turns to gas. The release of gas is nitrogen. That's what you hear. And when you adjust your knuckles, that would be nitrogen releasing from those two joint surfaces. Could you adjust yourself so much you get arthritis? The research says that's impossible, at least at this point. What they've been, people probably told you, don't crack your knuckles, you get arthritis. Some people might think, if I crack my neck, I'll get arthritis. We don't want you to crack anything yourself if you don't need it. And some people think, well, it helps me, but you're probably not really treating the root cause of the misalignment. Those are the ones that usually only the chiropractor can find and correct because they're hard for you to release. Those areas have been hunkered down and tight for so long. When you go to just move, you're moving the easy stuff. And that can mechanically make you feel better. We call that mechanical aspirin. Just pop yourself around, feels a little bit better. But true adjustments are a different level, okay? But the sound is the same. It's the release of those gas bubbles. But again, you don't need to hear a pop. There's plenty of people, if you were here the 2 weeks I was gone, Dr. Callie might have used an instrument to adjust you. You wouldn't have felt any pop. You might have felt pressure, and people did really well with that. So there's a lot of ways to help the body reboot. It's not just one way. All right. How safe is chiropractic? Really, the literature would say that several reviews of the literature would say it's extremely rare to be seriously hurt. Extremely rare. Getting hit by lightning is more likely than having a more severe event in the chiropractic office. You know, some people may know someone who's been hit by lightning. It was pretty rare, right? That doesn't mean that things can't happen. Stress, strains, and sprains can happen and things like that. But usually a lot of that is the body having a reactive spasm to the changes that we're trying to make because it is trying to adapt to a new position. So a lot of untrained healthcare providers would say, oh, that looks dangerous. And they're probably just going off of some YouTube video they've seen. They've probably never been in an office. Truly, they probably aren't getting adjusted themselves. And when we see some of these things, it may look dangerous, but truly, it'd be really hard to cause a stress to your body if you're knowingly there. You know, I know I have one guy, we were just talking, my son was on a visit to a lacrosse program, and the guy's like, he works at a chiropractic school, but he's not a chiropractor. And he's like, I still think about how, in those Rambo movies, how he'd break people's necks. And somehow that's still true to people's heads. So it's very, like, in order, if a neck was to break, you'd have to have your chin touch your back, okay? This is never gonna happen in our office. If you ever watch anyone's head, it barely rotates. It's more tilted. So when we talk about things that are unfounded, a lot of the unfoundedness of chiropractic being unsafe is because someone knew someone and there's just this hearsay about it being injured. So know that chiropractic care is extremely safe. Last point I'll make on this, insurance companies know how to make money. Did you know what industry that they're part of? Like healthcare, banking, what's the other, agriculture. What do you think? Insurance companies. What industry are they regulated by? It's not the healthcare industry. It's the banking industry. They're banks. Insurance companies act like banks. Money in, money out. If they don't pay your claims, the money stays in. They pay your claims, the money goes out. They're not really in the business of making you healthy. They're in the business of protecting major losses for you. And they can happen, they can. But there's enough people paying into them that are not being paid out of them, or they would be at a loss. And it's one of the few industries that I think consistently makes money. The point is, though, they're really good at making money and they know risks, right? Insurance companies know risks. So for car insurance, they know that if you've had tickets, if you've been in other accidents, if you're a young driver, you have more risk, right? They know the risks. They have actuaries who figure it out. Malpractice insurance has actuaries. You know, we pay, chiropractors pay malpractice, medical doctors pay malpractice, and a lot of other people pay malpractice. It just means that there's a chance things could go wrong. And if they really went wrong and it was serious, the doctor would rather not pay out of their own pocket. They'd rather use insurance to pay for that. So there's an amount of risk involved in treating someone chiropractically. There's risk involved in prescribing medication. There's risk involved in doing heart surgery. There's risk involved with doing pediatric heart bypasses, right? There's a lot of risk in pregnancy. So some of the highest malpractice are usually obstetricians, surgeons and things, obviously more risk in what they're doing, okay? In the relation, chiropractors pay about $2,000 a year for malpractice insurance. That might be less than some people pay for their car insurance, okay? It's probably similar depending on how many kids, if you have teenage drivers like I do. Your probably base primary care physician who is mostly referring to other practitioners and makes some medical recommendations of medications, they're probably paying at least $30,000 to $60,000 a year, which means that the risk in them performing their day-to-day duties is what? Like 30 or more times higher than me making an adjustment day-to-day. So if you're a bad driver, you're gonna pay more. If you have more risk, you're gonna pay more. We pay very, very little because there's very little claims that have to go out of a chiropractic office. So if you don't trust what I'm just saying, then know and look at the actual amount of malpractice that people pay, and you'll know that these insurance companies know their risks, and they do really well at knowing their risks. And if that's what they believe chiropractic risks are, that's because that's the truth of what they see out in the legal system. So is it safe? Follow the numbers. I'll tell you the truth. Let's talk a little bit about headaches. Chiropractic care is definitely recommended for cervicogenic headaches. And I can tell you that the amount of people with poor posture in this country is an epidemic, right? What do we say? Epidemic. So if you looked at someone's posture, and Lena, you've learned how to look at posture more and more. I mean, how many people would you say look like they even have ideal posture?
Very little.
A small percentage.
Yeah.
And your posture is going to affect your musculoskeletal system. So even if you are dealing with headaches that have multiple factors, let's say due to hormonal dysfunctions, chemicals, and other problems, there's a good chance too your neck has misalignments as well. So depending on how much all those are stacking up, even removing and releasing the neck from tension can significantly improve that. It may not mean that it just gets it gone forever because there are a lot of factors, but our posture is so poor that most people need some reset in their neck. Like chiropractic is very effective with headaches because most people do suffer with tight muscles, and if even so, they're reactive. Number one thing in our office that we want to make sure everyone realizes is that just because you see a chiropractor doesn't mean you have to go forever by any means. You could choose to go once or a million times. Our patients realize typically that their bodies function better and they want to stay at that level. So in order for our patients to stay at that level, they usually choose maintenance care. That means some kind of regular care, every couple weeks to once a week or something like that. But no one is ever stuck here. You're not addicted to chiropractic care, but you may realize when your body functions better, you want to keep it that way. And so most people realize that there's enough stress in the environment that they need to do something to de-stress their system on a regular basis. And that's why I choose chiropractic care for the long term. And when you understand the importance of how your body is connected to your spine, then you'll realize how important it is to get checked up. There's no pill, potion, or lotion that's going to realign your body and reset it the way that an adjustment could when you need that. So most people choose to do that, but you don't have to. Affordability. I think a lot of people just assume that chiropractic care isn't covered. It's probably untrue. I think most insurances cover chiropractic care anymore to some degree. It may not cover the amount of care you need, but chiropractic care is covered by a wide range of insurances. The Medicaid system covers it, Medicare covers it, work comp covers it. So chiropractic care is definitely well covered. But I think the thing to realize is that an ounce of prevention is worth a pound of cure. Care is very affordable. We do our best in our office to make sure that everyone has a care plan that has a monthly recommendation of a budget. And this way you know what you're getting into and you know how to budget for it. We'll do everything we can if people want to be here and get care to make it affordable as we can within reason. So know that everyone gets options of payments, even if there isn't covered by insurance. So I guess the question is, what are some of the things that you can do to get the most out of your chiropractic care, and how can you share this information with others? And I think there's more and more people need to know more about what it is to do. So one of the best things I can tell you is if you're getting regular adjustments, make sure that you're getting 30 minutes of movement, every day, if possible. If you are using a computer or a phone, make sure you set up your workstation properly. Make sure everything's at eye level. Things you use a lot are in front of you. These are all so important. And when you are going to bed, if you can change that sleep position, make sure you have a good supportive mattress. But when you're sleep position, make sure you're not sleeping on your stomach if you can avoid it, because that's going to put a lot of stress on your spine. If you're on your side, make sure you got a pillow between your knees. If you're on your back, make sure that you got a good pillow, but not too high of a pillow to push you forward, and maybe support underneath your knees. So those are the kind of biggies that I'd tell you to do that. Stress is a biggie. So limit your stress as best as possible. We have many workshops that come up every month about how your thoughts are things. So just getting outside, deep breathing, these are the simple things you can do for stress reduction. Just get on a sleep schedule. Very important. Make sure you're asking questions. I think the best learners ask lots of questions. So make sure that you have fun here, that you ask us questions, and you support your health by making sure that you stay involved, because the more you can understand about your health, the better you can control it. You guys have a good night. I'll see you later.